Good evening and welcome to another episode of Real Thoughts and Conversation. I'm your host, Leon Thomas. Thanks for joining us tonight. Real Thoughts and Conversation is a production of the Leon Thomas Group. To learn more about us and everything we do, go to our website, theleonthomasgroup.com. Last week, we had Tonya Henry on as our guest, and we talked about the many diseases that she has. And tonight is part two, another episode with Tonya. And this time we have her doctor, one of her doctors, Dr. Eric Schultz, with us. But first, let's talk to Tonya. Let's bring Tonya on. Tonya, it's great to have you with us again. We're glad you're here. And thank you so much for being willing to be our guest again.
You're welcome. It's good to be here.
Yeah, thank you again. So let's recap for those that weren't able to watch last week's show. Tell us again the many diseases, the many illnesses that you have. Give us a real quick rundown of those, and then we'll talk a little bit, and then we'll bring your doctor on.
Okay. I have gastroparesis. I have Ehlers-Danlos. I have mast cell activation syndrome, primary immunodeficiency, dysautonomia, which includes things such as hypotension, temperature dysregulation, migraines, and things such as that.
And you told us last week about some of the things that you have to go through just in your daily living, and it's just amazing what you do and how organized you are in doing it, but also that you've become an advocate for others with similar illnesses. And it's so nice of you to be able to do that, to take this and make it something positive for someone else. And tell us about the many different organizations that you work with in that regard.
Well, I am an OLI ambassador, which means I help those that are on feeding tubes or IV nutrition. It can be someone who is brand new to the journey, or someone who just has questions, or they have some kind of problem come up. So they can reach out to the OLI Foundation, and I'm one of the ambassadors that help along with that. Mm-hmm. I also am on migraine.com, and on there people come online to the Facebook page, and I assist by giving people articles that they can check out for information, as well as answering questions and just chatting with people on that site.
Mm-hmm. Now, before we go any further, I want all of our viewers to understand that although we're talking about medicine and illnesses and medical conditions today, please do not take everything that you hear here and say, "Oh, that's very similar to what I'm experiencing. I probably have the same thing." No. This is not to be considered your source of medical information. If you're sick, see a doctor. If you're hurting now, call 911. Do not tell anybody, "Hey, I saw it on Leon's show and that must be the situation." No, please don't do that. So please understand, we want you to get well, but don't take what you hear here as the final word on anything that you may be experiencing. So Tonya, you go through all of this for numbers of years, and then you got in touch with the right medical personnel to find out everything that you had, and they put you on the right treatments, and you got in touch with Dr. Eric Schultz. Let's bring him on now. Dr. Schultz, good evening. Thank you so much for being with us.
It's my pleasure. Thanks for having me on the show. Yes. And just want to say that I reiterate what you said, Leon, that don't use this for your medical advice or anything that would substitute for an actual physician. If you're having symptoms, you should go to your own doctor, discuss this with your doctor, and seek the right medical attention. If you're having any emergent symptoms, you should be going to the emergency room as well. So I agree with you, and I'm happy to be on the show and help you explain some of these things.
Great, thank you. And we were joking before the show that I welcomed you to our studio, and you met our producer, Dr. J, back screen, and I said, "Hey, and that's Tonya. You probably know her."
Yeah, but only like this, right? We're going around and we don't know each other except like this now. So she probably doesn't recognize me without my mask on.
Well,
Yeah,
we're being safe, right on. Yeah, that is
yeah.
so good. So, Dr. Schultz, tell us about your practice and about what is mast cell disease. We understand that's something that Tonya has, and also primary immunodeficiency. Tell us what
Sure.
those things are, please.
Yeah, so I'm glad you asked those questions. I can't discuss any patients or patient unique information, but I can definitely discuss those as topics of disease. My practice is I am an allergy immunologist as well as an asthma physician. My background is I did residency at University of California, Irvine, and then I went to Duke for my fellowship and spent about 10 to 15 years of my life doing clinical research. And along the way, I studied the mast cell. So, in particular, the mast cell is an immune cell, and it starts out in the bone marrow. And it develops in the bone marrow and then comes out as what's called a mast cell progenitor cell in the bloodstream. Okay. And so it goes around in your bloodstream and it homes to target organs. And this is a normal process. This is what it should do. But the unique thing about the mast cell is it is involved in so many different organs. It goes to your skin, it goes to your lungs, your GI tract, including your stomach, and then even can go into your brain as well as other organs. And what it does is it's sort of like you're in an inner tube in the river, and you have friends that are there on the shore, and the friends reach out and pull you into shore to join them. And that's what happens. You have these molecules called selectins and integrins, sort of like your friends, that reach out and grab the mast cell and pull it into the target organ. But that's not all. So once it gets into the target organ, it goes through a further maturational process to ultimately become either a connective tissue type mast cell or a mucosal type mast cell. Now, different organs are going to have different types of mast cells in them, either mucosal or connective tissue. But the bottom line is these are cells that are granulated. They have all these little granules or pockets inside them that contain chemicals. And the chemicals elicit a function. So when the mast cell actually gets activated, when something attaches itself to a receptor on the mast cell then degranulates and releases all of its chemicals, its evil humors. And it's actually really pretty. If you look at it under a microscope and you stain it in toluidine blue and it releases all its chemicals, it's a very pretty show that it puts on for you. But when the mast cell releases its chemicals, these can cause inflammation and sometimes even solicit other inflammatory cells to come join the party, and then they release more chemicals. And so ultimately, the symptoms that you feel could be from histamine release from the mast cells, interleukins, leukotrienes, TNF alpha. These are chemicals that can cause inflammation. Blood vessels can swell up and become leaky. You can have itching occurring. You can have airway hyperactivity or asthma. You can feel your throat kind of closing or swelling. Stomach upset, which could include, dyspepsia or, bloating and diarrhea, abdominal pains and vomiting in extreme forms. And then ultimately it can even affect your cardiovascular system. So your heart rate can go up. Blood pressure can go down, and then you can actually have subsequent anaphylaxis where we have to, treat you emergently with epinephrine, like an adrenaline pen. So that's kind of the mast cell in a nutshell. Now, mastocytosis and mast cell activation syndrome, now that you have sort of a basis for how the mast cell works, along that line from the bone marrow up to the target organ, something goes wrong. And so the mast cell doesn't develop right. And so instead of needing a normal process to occur, for example, if you're allergic to peanuts and you eat peanuts and the peanut comes in and then attaches to the mast cell, that antibody connects with an antigen and then detonates the mast cell and it erupts open. You don't even need that process to occur, actually. Your mast cells just get twitchy and they just degranulate without the provocation. Or very little provocation. And so those patients can have a spectrum of different disorders. The mast cell activation syndrome patients can just be more reactive to medications. They could be more reactive to the environment or chemicals or foods. On the opposite side of the spectrum, the mastocytosis patients can ultimately even have forms of cancer where, going back to the bone marrow, it's invading the bone marrow, it's expanding, taking over other cell types, or causing blasts to occur. And then the patient can ultimately get diagnosed with cancer and then seek treatment from a cancer specialist. So that's kind of the mast cell and mastocytosis, mast cell activation syndrome in sort of a nutshell. You asked me about primary immune deficiency, and it's a somewhat different question. Primary immune deficiency is where you have issues with your immune function, and it can entail different aspects of your immune system. In one sense, you have your humoral immune system where you have antibodies that are made. In another sense, you have your cell-mediated immune system where you have T cells and lymphocytes sort of being activated. And then you have your innate immune system. And so I like to kind of describe that as your special forces. It's sort of, drop the soldier in and kill anything that looks abnormal in a 20-mile radius. And so these three, although somewhat separate, do play into each other. And so primary immune deficiencies can involve abnormalities, particularly in the humoral one, or where antibodies fail to form or abnormally form. And some of those you get, which is the most common one, is what's called IgA deficiency. And so immunoglobulin A, which is a barrier antibody, actually functions in your sinuses, in your airways, and in your intestines. And it helps keep things out. Like, it's sort of your guard to keep things from penetrating into your bloodstream. And so patients who have IgA deficiencies can develop this even later in life. They can have recurrent sinus infections, they can have ear infections, pneumonias, bronchitis, and subsequently they can get diagnosed and seek treatment in that sense. There are obviously more severe or affecting immune deficiencies like common variable immune deficiency, or CVID, hyper IgM deficiencies, to name a few. But those are involving different antibody lines that can lead to increased risk of infection from not just COVID. We get kind of tired of talking about that sometimes, but it's definitely super important. It's still out there. But it's all those bacteria, viruses, even fungal infections. And it can be diagnosed later in life, all the way back until you're, a newborn child. And so it really is a massive classification of illnesses that you really should seek medical attention. If you notice that you've had more than 2 pneumonias, particularly in the last year, more than 4 or more in your lifetime, if you have recurrent sinus infections where you have at least 3 to 4 sinus infections per year, if you have any kind of weird infections, like you had meningitis, or you have, recurrent skin abscesses or fungal infections, you should definitely seek medical attention, talk to your doctor. It's not a hard thing to screen for. They can do, pretty easy blood tests or get labs for this. And then if they need to, seek one of our immunologists who are very knowledgeable and help that patient out.
Mm-hmm. Wow. This is just great information. And Dr. Schultz, I don't know if you were able to watch last week's episode, but some of the things that you were talking about in your description of it, Tonya gave us a rundown of a lot of that information, and it was so amazing that, Tonya, you were able to communicate it very much so like Dr. Schultz did, but also Dr. Schultz, you went into greater detail about it, which I'm sure our viewers very much appreciate, and that's why we wanted to have you on the show. Now, Tonya, tell us, when you met Dr. Schultz, having the symptoms you were having, and you finally get in touch with Dr. Schultz, clearly he knows his stuff.
Yes.
Right? He knows what he's talking about and can explain it in a way that many of us can understand or get a good sense of what's going on. When you got in touch with Dr. Schultz and you saw him and he said, "Hey, we have a plan," tell us what your mental state, what your feeling was like when you finally met him, Dr. Schultz, a guy who knows what he's doing. Tell me how that made you feel to get in touch with him.
Well, it was great. I was already established at the clinic, but when another provider was no longer there, a lot of people in my online group suggested Dr. Schultz. And so, of course, I had to do my own research and check out him online and read reviews for myself. And I was like, you know what? This is the doctor that I want to see. And I love being with Dr. Schultz. If I have any issues or any symptoms come up, like infection, he's always there to help me out immediately. It's no waiting around. So I love going to see Dr. Schultz.
Mm-hmm. Now, and Dr. Schultz, you met Tonya and you see all the symptoms and you look at her all the tests and blood work and all, and you see this, everything that she has going on from a medical perspective, right? Did you look at this and go, you know what, this is a classic case of a boom, boom, boom. I've seen it before. It has to give you a sense of accomplishment, a sense of pride, well-being, that you have the skills, you have the knowledge to help someone, all of your patients, but someone like Tonya who has been suffering from these things. It's got to make you feel good that you have gifts that you can use to help her.
I appreciate that. It does feel good to do that. You always question yourself, though, to be honest with you. You always have to second guess and just make sure that you're making the right decisions. And, so in medicine, there's sort of the rule first is do no harm. And that is something that I keep close to my heart. And I want to make sure that I do the best for my patients. And that's a constant evolution. It's, Tonya is an amazing person, and she is highly intelligent and tough as can be. And I can't say anything specifically about the conditions for her, but at the same time, as a physician, I think it's an honor to do this, and it's an honor to work with patients like Tonya. And I just am thankful that you guys are having me on the show to discuss it.
Yeah. I think sometimes as patients and families, we call a doctor, we go visit a doctor and we go, okay, I'm having this is wrong, take care of me. And the doctor does that. We don't show enough appreciation to the doctor and look at things from your perspective. You've put in years of study, and now what you're able to help people. That's just something that I wish more of us would do, was show that appreciation to the doctors and so forth. I really just hope that everyone watching the show, that whatever your condition is, even if you're just seeing a doctor because you have high blood pressure or an arm is hurting, that you appreciate the knowledge that they have and how they share it with you, and to make folks better, to make them comfortable like you're doing for Tonya. So I just hope everyone appreciates that. Yeah.
Well, I appreciate you saying that. And I also think this is a mutual relationship. I mean, we're not taking care of, a patient on a ventilator in the clinic, right? I mean, we're not making unilateral decisions. This is a joint, relationship that we have to do our part too. We have to communicate effectively. We have to explain to our patients why we want to, put them on medications, what the side effects are, and what to do in case it doesn't work. And so we have to, abide by that responsibility and respect the patients as well. So it's 100% a mutual, communication between the doctor and the patient, and it's much appreciated when the patients are understanding and thoughtful and even do research. I don't mind if people are on Google and look things up, because you're going to look at it later anyway, right? So might as well talk to me about it during the meeting. And so I can help guide your research, because I get a lot of really intelligent patients who ask great questions. Yeah. And sometimes they think it's far-fetched, but it's not. You're linking it for a reason, and we need to do our part to help go through that. So.
Yeah. My name is Leon Thomas. I'm here with Tonya Henry and Dr. Eric Schultz. discussing Tonya's illnesses, and Dr. Schultz is one of Tonya's doctors who's given us just a lot of insight into what he does and how he helps patients. I'm Leon Thomas, the president of the Leon Thomas Group. We do a lot of things to help college students. We do a lot of things in the virtual event scope. And now we're going to take a quick break. And during this break, you're going to see some of the work that our students, employees, and interns have worked on. We'll be right back. And when we come back, we're going to talk to Tonya and Dr. Schultz a little more. Here we go.
Renting is everything. It's style at your doorstep, off the runway and into your closet. It's every trend you've been dying to try and every designer you've yet to discover. It's wearing it your way every time and making it count everywhere you go. It's never worrying about what to wear because something new is always coming your way. That's why renting is everything. New styles, top designers, all for a flat monthly fee. Start your subscription at renttherunway.com.
Slow roasted over hickory fire and pulled by hand. This is the way pit pork has always been done. Pulled pork lovers, rejoice. The smoky old days are back at the Smoke Shack. From the creative team that brought you the Browning Project and Dead by Morning comes a new thriller that will change the way you look at white-collar crime forever. Falling from the Sky.
Water. It's everywhere. We drink it, we bathe with it, we cook with it. Coffee's made with water. Toilets won't flush without it. It's used for washing clothes, dishes, utensils, pots, pans, floors, and our teeth. Plants and crops need water, animals drink it, and fish need it too. And don't forget, we can have a lot of fun in the water. Water. What would we do without it?
And we're back. I'm Leon Thomas. You're here watching Real Thoughts and Conversation. Our guests tonight are Tonya Henry and her physician, Dr. Eric Schultz. Let's bring them back up on the screen for our next final 7 minutes that we'll have in the discussion here. So, Dr. Schultz, you meet Tonya. At what point did she tell you of the advocacy work that she's doing?
I would have to say you told me early on, and I think that that's fantastic. I was very supportive of her reaching out to different organizations that could connect her with, medically needy or complicated patients. I mean, really, a lot of times people feel alone. They feel like they're the only ones that have some of these rare disorders, and they need somebody who's strong and thoughtful and intelligent to help guide them through some of this. I believe she did tell me early on, and I offered my support.
Yeah, great. I'm glad you did that. And Tonya, when you told me, and I learned about some of the support work that you were doing through social media, through Facebook. Yeah, I saw some of the posts that you made, and we talked about it some last week. A lot of the comments that we received about last week's show, basically in these two areas. One, wow, to go through all that and look at her attitude. And secondly, and she's helping people. I mean, come on, you're going through all this and you're still helping people. That is just something special that you're doing. So thank you for doing that. And tell us what else or do you have planned? Tell me, are there any activities, any events that are going on that folks should know about? Any articles? Tell us about all the websites that folks can go to get information. Fill us in on it all.
Well, I write for migraine.com. I'm one of the contributors. So if people want to see some articles that I've written, they can go to migraine.com and check out my articles. I only have 3 articles so far, but more will be coming. Also, if you have migraines, I suggest joining the Facebook group migraine.com. That's a good place to find out information about it. Also, if you know someone with a feeding tube or that has gastroparesis, have them go to the OLI site, which is www.oli.org. OLI is spelled OLEY.org. And also, if you have different rare diseases, check out rarepatientvoice.com.
All right, great. Thank you. Thank you so much.
You're
And
welcome.
Dr. Schultz, one final question for you. A lot of times folks have a lot of conditions and a lot of rare diseases going on. And family members don't know what to do. They don't know what direction they should go in to get a diagnosis, to get a treatment. What advice can I give to folks that we can give here to say, look, if you've got something, check here, do this, keep pushing. What's the standard protocol that someone should use to figure out what's going on?
I don't think there really is a standard protocol, to be honest. I think with especially rare diseases, you need to be your own advocate. And sometimes it's uncomfortable, to be honest with you. But I think you need to start with your primary care physician and, really check in with him or her and make sure that, they're running labs if they need to, that they're discussing, why they think it's something and why they think it's not another thing. And then through proper referrals, you can get to the specialist that is right for you. And it might be, honestly, guys, that you might not get an answer right away. And so sometimes this takes years with some of these rare disorders where, especially autoimmune disorders, where they do a set of labs and then the labs are negative, and then a year later they do the set of labs and they're negative again, and then your symptoms come back again and they do a set of labs and they're positive, and then you get a diagnosis and you get put on treatment. So just because a door closes doesn't mean it won't open back up again later, and you just need to be thoughtful. And I highly recommend, most of the people out there, you guys are smart, and you are Googling and thinking and processing, and no one knows your disease better than you. Okay, even the doctor. So make sure you document, a timeline and the type of symptoms that you have, and being able to provide that information very logically and orderly to your doctor is so important, because they only have a limited amount of time sometimes too. But biggest advice I can give is just be your own advocate.
Mm-hmm.
Yeah.
Mm-hmm. Be your advocate. And also, I think it's interesting you said to write things down so that you have a timeline as well. So you can say, this started on June 1st of 2018, and this is what I experienced the next day, and so forth. So I think that's some great information. All right. Well, let's get away from illnesses. Let's get away from medicine for a second. All right. I'm going to ask Tonya, you 2 questions, and we didn't talk about this before show. So if I ask you a question, and there isn't a real answer, can you kind of just make one up so we can have a good conversation here? All right. So here we go. Tonya, your favorite food?
Well, it used to be strawberries and Twizzlers, but haven't had either one of those in I don't know how many years because, I'm on IV nutrition and I don't eat any meals like that.
Mm-hmm. Okay. All right. But it used to be what?
Strawberries and Twizzlers.
Strawberries and Twizzlers together?
No, just I used to love Twizzlers and used to get Twizzlers for Christmas, birthdays,
Okay. All
everything.
right. All right, Dr. Schultz.
Food. I love Mexican food. I'm from Southern California. Don't hold it against me. And just love good Mexican food. Yeah.
All right. Right on. Right on. I like Papados restaurant there in Texas. I like that.
Yeah.
All right. Tonya, do you have a favorite sports team?
Well, since I'm from the Carolinas, I would say the Carolina Panthers.
Okay. Dr. Schultz.
I was so worried you were going to say UNC. I'm a Duke fan, so yeah. I still love North Carolina, though. I have two boys, and one wears a Duke sweatshirt, and one wears a UNC sweatshirt, and I love them both equally.
Yeah, Dr. Schultz, our producer Jay, just sent me a message asking if we should kick you off the broadcast now.
Totally
I responded with, "He's been on 31 minutes now. It's too late.
Too late. Yeah.
Let's leave him on." Wow, Duke and Carolina, but you went to Duke, so we get it. All right, right on. Good deal. All right. Thank you so much, both of you, for being with us. Tonya, thank you again for being with us. And we're also trying to line up show number 3 to have folks from some of the organizations that you're with. So thank you for that. Eric Schultz, Dr. Eric Schultz, thank you also for your time. Thank you for sharing with us tonight. It's very much appreciated, both of you. Thank you.
It's a pleasure, and thanks for doing what you do, because this is so important to get great information out there. I can't tell you how much I appreciate that. So
great. Thank you. Thanks again. My name is Leon Thomas. You just watched an episode of Real Thoughts and Conversation. This is a production of the Leon Thomas Group. To learn more about us, go to theleonthomasgroup.com. Thanks for watching Real Thoughts and Conversations. We'll see you next week. Here we go.